did make a complaint later on. It was actually quite disrespectful how she spoke to him. And I can understand so many more people won't actually contact these services because of how they're treated or how they're perceived. Now he lives a happier life. He's now able to access services, he's able to go out and do as he was doing before. He was very happy and active before, but all of this clouded his mind for a year. And he said to me as I left, Gay, I'll be contacting you in April because I need to renew all my direct debits. So I know in April he'll call me so we can go through to renew his direct debits. But something that's done for him is it's meant that he knows the right person to contact, which isn't the GP, it's actually the social prescriber. Also, I've had a single parent, the father of 3, facing a problem that his 2 children that he was funding into university were now facing removal. His words were, I'm a dead man walking, because he felt the pressure of trying to find the finances for them, working 3 jobs, using the food banks, just about managing to function. And he said, I'm a dead man walking. It's very hard to walk away from someone when they tell you that, but with a bit of time and patience, we worked out talking to the university how they could actually assist him. We also spoke to advisory services about how we could look at how we could manage his debts better and how we could actually help him back into a better way of working. Working with the food banks, he also found a new community of people that he could spend time with while he was waiting. He'd sit, have a chat, have a coffee. A few months later, we contact. He's like, Gay, I'm all right. I was like, you are? Everything is not resolved. However, he's got plans in place. People are supporting him. He's being helped. And he felt confident now to call and say things are improving because of the power of what social prescribing can do. And that's me done for today.
Wow, feels like there's been so much, I've learned so much tonight that I feel like I haven't got much more to offer. But one of the things that I think we've been looking at is trying to interpret and understand what's already been said tonight and put that into practice. And I don't think we've got it at all right, but I think we're on the track and moving towards that. And one of the things that I'm Kevin Fairview. I work with Imagineif, but we run programs down in Cornwall. So Cornwall, as you know, is a very rural area. We've got a lot of issues around ageing population and that. And we're really trying to look at how do we best support people and their communities in those kind of areas and what's going on. And there are 2 things that we've worked on recently. One are community health hubs. We'd like a better term for that, but something where people come together. And also managing chronic pain through cafes and working with cafes. So a lot of what you've heard and has inspired me is, as I say, what we're trying to do and put into practice. And the starting point, I mean, I'm going to start with the biopsychosocial approach, because I think what we're trying to do is the social psycho-bio approach. Our starting point is, where are people? What are people doing? What are people thinking? How are people behaving? And working with people in communities. Now, you'll be understanding Cornwall, there's a lot of rural communities, a lot of little villages. So it takes someone that lives 10 minutes away from their GP surgery. If they don't have a car, it can actually take 2 buses going from one part into Truro and getting a bus out to Perranporth. So actually accessing services can be really difficult. So we do look at kind of more micro approach to this. But the ability for people, so the community hubs, what we recognised is what we wanted were places where people could feel part of something. And we talk about friendly environments that are environmentally friendly, places where people can come and go and feel part of something, but supported by the communities and people that are already around them. So it's building on what's kind of support is there. By doing that, what we're recognising with the different hubs is that we're building up a volunteer base, we're building up a support base, and it is helping them become more and more sustainable. So people can enjoy these activities and facilities, but it's not all about funding. It is about connection and using the quality of relationships that are already there and putting them into practice. That by having community hubs, the health hubs, what we're able to do is bring a range of different people together. So we do have GPs, community matrons, district nurses, psychologists, health coaches, all coming in as part of a program. But beyond that, we're also bringing in other members of the community, particularly arts, and I'll pick up on arts and stuff like that, arts, yoga therapists and other people like that, that become part of one unit. And in one of our spaces, we actually have a community fridge, which is what we would know as food banks. More people are using that community fridge now than were before, because they can come in without knowing it was just a community fridge. They're coming in for a range of other things. But the starting point is tea, coffee and cake. People do like a piece of cake, a bit of coffee, coming and talk. So people are joining and saying, I don't normally drink tea at home, but because it's here and this is going on, this is the start. That's the start of that social interaction. It's the start of, I can be somewhere with someone over a cup of tea, and it's no more than that. And it's from then that things begin to build up. But what we're also looking at, it is personalised care. It is working with people and saying, what is it's important to you? What do you want? What can we do? Not to do it for you, but what can we do to support you towards that? And helping people understand things. So the making research accessible, which I think talked about earlier on as well, it's like, you know, I used to be a lecturer, tons of research reports that get written, get read a couple of times and left there for ages and ages. But actually, what can we do that bring some of that to life for people? So we do create projects like I Belong. That's a mental health project from a lot of people who say, I really do feel isolated and lonely and nobody understands me. Bringing people to say, actually, it's not about grieving or loss or mental health. It's a sense of belonging, that being part of a community really does have a number of benefits for all sorts of reasons that we've heard. Make My Day. Just finished a European project on social emotional learning and executive functioning of the brain. And part of that is we work with children in schools and talked about how can you look after other people? What can you do to support each other? And one of the things, they had to produce a product. We had a Dragon's Den, and one of the products, a group of year sixes was a book called Make My Day, where they actually drew it and came up with what you can do to make each other's days. And now they use that as a tool to go and read to other children. So it not only brings in the mental health side of it, but also brings in reading, connecting with other people and stuff like that. And that it is systemic. That we cannot ignore what's already happening out there. I used to run programs or support programs around parenting, Triple P and things like that. And what we found is there were a lot of people who got trained, who learned to understand, to behave differently, had different skills. But when they went back into their communities, they were surrounded by people who didn't have that knowledge and who would say, do you really want to be doing that? Sounds like a newfangled idea, not sure. So there's something about working with the community systems and influences that are out there as part of it. So that does mean we have been working with parish councils, with surgeries, but also with sports clubs. We're training rugby coaches to think about how they can have a different conversation around well-being alongside shooting, passing, dribbling, or whatever else you do in rugby. Dribbling may come after the rugby, I'm not sure. But there is that part. But also parish councils, businesses. So actually now we have businesses, so we're saying within the health hubs, we're providing food, we're providing support, we need rent for the village hall, etc., etc. So a local business can say, do you know what, for £50 a month, I'm quite happy to put something in. You don't need tens of thousands, as they've often felt. But then everybody feels that they have a part to play. Everybody's got something to offer, and that's one of the kind of core philosophies around that. Everybody has something to offer and can contribute towards it. And as a result of that, we are trying to, now, we've got links with Trellis Hospital in particular in Cornwall, where we are really supporting the hospital discharge, which, as all of you know, is major. So, very quickly, just a sense of what we're doing, because, as I say, I think we're trying to interpret what you're saying and say, what can happen. They're regular. Most places now, at least once every 2 weeks. Some places are twice a week. There's links to the health services, the referrals and stuff come from the GPs and other health professionals, but also other places as well. We've got specific elements, so we've got social prescribing, we've got work on frailty and building up with frailty hubs, and with medication management. So people have got that opportunity over a coffee, over a cake, probably not great managing, but managing their things. In addition, we've got things like armchair yoga, walking groups. Last week we had a group in Perranporth. One person had come along and said, I'd like to go for a walk. Who would come? We thought, 2 or 3. 22 people left the hub. 84 people had attended that hub that morning. 22 left to go and walk on Perranporth Beach and start that connection there. That didn't come from us. It wasn't. It came from people that were part of that process. I've said about the fridge. The other thing we're finding as well is we're getting people that are felt because of their health they didn't have access to employment. And through inviting work with National Career Service, people are getting more confidence. And just recently we've had 2 or 3 people go out, get their CVs together and actually go out for interviews, and 2 people have got jobs within that. And also linking up with others. So farmers, we've just taken on a farm in the Health Hub. You will understand that rural communities, there's a lot of isolation, suicide rates, domestic violence are very high amongst those communities. What the farmers have said to us, listening to the patient voices, the 2 people that they used to turn to for support was the GP, that they're seeing less and less of, and the bank manager, who is really, really, really hard to see these days. So actually, you don't think that the bank manager was a point of contact, but it was a regular trusted person that was there, that has gone. So who do they turn to now? So we're actually talking to vets, because the vets are more likely to be going in as part of that because of the link. But it is someone about who's there on a regular basis to support that. So there's a range of things. It is holistic. Health, employment, productivity, which is, we're thinking about in terms of GDP and that, are all linked. What we have seen is that people talk about building confidence, people feel less lonely and isolated. Employment, I've talked about. Lots of volunteering, lots of people attending. And what's behind volunteering is not, I just want to do good or feel I'm giving something back. It's a sense of purpose. We all talk about resilience, but I actually believe sense of purpose is as important as resilience within there. People creating new projects and partnerships, so it becomes self-owned, self-managed in part of that. People are fundraising, and we have seen reduced visits to the GP, improve well-being. And important, family now, bringing family members to get support when in the past they didn't use a GP or whatever. So it is bringing other people into the system. Last slide, almost. Chronic Pain Cafe, so we've just launched 27th of last Friday of January, the Eden Project. We launched a project called Chronic Pain in Cornwall. We're going to have 15 cafes, and we've trained 50 baristas. A barista is a pharmacist, a GP, social prescriber, who has gone through the 10 Footsteps training that's run up through Francis Cole and up in Durham, so that we've trained those people to be able to come run cafes where it's informal conversation, opportunities to talk, but particularly use a skills not pills approach to managing your medication, managing your health, managing your pain. And already we've had such positive feedback. People say, my life is beginning to change. I've started doing things differently that I couldn't do before. I'm thinking differently, therefore I can behave differently, therefore I could support other people within that. And there is just one other thing which, because we've talked about trust, one of the things I do think that with the social psychobio, which I've just made up while we were thinking here today, but with that part of it, is I do think that you do have a cup of tea, you do have a piece of cake, you do start talking to people and you think, okay, you're not so bad, John, to talk to. I can start talking to you a bit more. That bit builds on, and then you start having a deeper conversation. And that deeper conversation then leads into other things, which is, I am really concerned about who I am or what I'm going through and how to manage that. And I do believe that within those relationships that we're seeing, there is a point of trust. It's a geographical point in the relationship where people do get to trust someone from that. But what we are seeing, I think, is more and more people saying, once I've got to trust someone else, what really is more important is I start to trust myself. and I can start doing things. So in terms of self-management and thinking about how I can be, if I can get to that point where I'm confident enough to be in a relationship and trust someone there and move on from the T&K to something else, I actually begin to do things for myself. And we've seen it, whether that's employment, setting up walking groups, armchair yoga, people have gone on to do things for themselves. And that for me is, I think, the empowerment and the engagement we want. So that's it in a very short
Can I invite all the speakers up? We've got 10 minutes, so dinner will be slightly delayed. And over dinner, you'll have plenty of opportunity to nab each of the speakers and ask them questions. But we'll just do 10 minutes with all of you on the platform. And while they're sitting down, do just grab a seat. A very big thank you to Jadinta and also Sarah, actually, for making this evening happen. And Jatinder's going to send you all a pack, and this event has been filmed, so it's going to be available on YouTube channel shortly too. So over to you. Any questions? John.
Hello, doctors. It's very good to see you all. It's actually very rare to see you all. These days, most often, I find that it's difficult to get a phone call with a doctor, let alone to see one face to face. Can you hear me?
Probably not at the back.
Okay. So I wanted to ask you if really this is not so much a medical issue, whether it's really a political issue. Because without central government support, you can't really sustain this approach. Are you confident that whoever wins the next general election, that you'll be able to do this and improve upon it?
Before we ask them to reply, can I take two other questions?
Hello. Question first of all about opiates. Do we have any understanding of the scale of the overprescribing, and is there any plan to achieve any particular reduction in their use, given the scale of the problem we have? And secondly, on sodium valproate, I chaired the all-party group on that issue for 2 or 3 years. It is a total scandal. And I wondered if you had any thoughts about how we do complete the journey of ending this awful, inappropriate prescribing. It always feels to me like doctors know now, they ought to know about the risk. And if doctors continue to prescribe, surely there need to be some consequences for doctors who continue to do that.
Let's take one or two more questions and then we'll go down the panel. Sophia?
It's a very straightforward one from Professor Avery. You mentioned about for weight loss, finding other methods rather than pills like exercise, etc. But to play devil's advocate, that's the success rates for people, who need to lose weight like exercise seems to be quite low. How do you perceive that you can overcome that?
Ursula.
A very specific question for Laura, which is, if it's correct, have we gone from 2 visits per year to 10 visits per year, average patient seeing a GP? That seems dramatic increased workload for GPs, if that's correct.
Let's take all the questions because I think we're going to only have time for everyone. So think about which ones you want to answer, okay?
Question for Gay. If a lot of your work isn't social prescribing, what is it? What would you call it?
Any other questions? Well done.
You might not like this, any of you. Are we intent on keeping everybody alive?
Well done.
Just a quick remark and a question about the factories that are creating health professionals of the future. Because many of the juniors and the medical students feel like giving up on the factories because of the skills that should be taught are not being taught. The skills that you describe here are music to our ears and are the ones that I signed up for medicine in the first place, but I don't see that in the emergency department. And it's also frowned upon when I practice this good medicine. So question of, we owe the future generation these solutions. What's the step that we need to take to support the future generation?
clearly we should all be learning to be baristas, shouldn't we? That's the message for me tonight.
Should we make nutrition part of the medical curriculum?
Yes.
A much bigger part.
Any more questions? Okay. Henrietta, do you want to start?
Shall I start? Okay, so I'm happy to take the question about sodium valproate and a little bit about industrialisation of medicine quickly as well. So what I think is needed is it's a system problem. So we need a system solution. I don't know if this is actually on. You can hear me all right. What we need to know is what do patients need? What do they need from the pharmacists? What do pharmacists need from the GPs? What do GPs need from secondary care? What does secondary care need from the regulators? And there's recent guidance that's come from the MHRA that because there are concerns about the children of men taking sodium valproate, but even more concerning about the risks to the children of the children who were exposed to sodium valproate, that the MHRA have recently issued new guidance that anyone under 55 will need to have 2 specialists to agree that this is the only medicine that can control their symptoms. So I think we're going to see a reduction, further reduction in sodium valproate being initiated and being continued. But the problems that we have at the moment are that there just aren't enough appointments for 2 specialists, let alone 1 specialist to be reviewing people's medicines on an annual basis. So I do think we need a whole system approach to the current risks, but also to significant reduction in sodium valproate initiation and prescribing, and I hope that's sufficient. When it comes to the industrialisation of medicine, I think that what we need to focus on is the culture. Because if you take, for example, the Leeds Way, and the new Chief Executive of NHS providers, Julian, has described how it was only possible to implement the lean methodology from Virginia Mason, which is the efficiency and reduction in harm, because they'd done a whole process of catharsis around the culture of the organisation. And when you get the culture right, you're then able to bring in safety, and then the money follows. But if we do it the opposite way around, where we focus on the money and not on safety, then we're just on the road to MedStax, basically. What we need to know is that people have read that report, they understand it, and they know that they're potentially putting their patients at risk of harm and death.
Laura.
If I just answer your question. So the statistics for the 2000 I just got from I think it was the national statistics, and then the latest one was we looked at how we've been doing a thing looking at how many appointments we're offering, and we've got 24,000 patients on our list now, and if we're offering at the moment, we will offer at the end of this year just under 10 times that, so just under 230,000 patients in the year. So that's how I've worked that out, and it feels like that's the same across the board. I mean, certainly when I talk to colleagues doing duty doctor now, you quite often have 80 or 90 people on your list that you need to see. So it's just it has just gone out of control, and I think it is because of the reasons that kind of stated there, where we just society's quite sick at the moment.
Right. Try and pick up on a few. So opioids, I can't say exactly what the size of overprescribing is, but it is considerable, and it's been driven by the fact, I suppose, we've been given the idea that you should always have a pill that can cure your pain, and we've been trained in what's called the WHO analgesic ladder, the idea that you start off with a medicine and you just keep increasing the dose. And it's only in more recent years that many of us are starting to realise that actually evidence for treatment of chronic pain suggests these things don't actually work. But the problem is we're in a situation where we've got millions of people
Yeah.
on these medicines, and that's why they're the type of thing that with the dependence-forming medicine framework we're coming up with, we're going to be trying to sort of dial back on this. We've really got to be doing lots of work in terms of trying, just as we've done with benzodiazepines in the past, not getting people onto these in the past, or having them on for 3 months and say, okay, we've got to 3 months now, these medicines are probably not going to be helping you anymore. So that's a really, really important thing. In terms of the question about exercise and weight reduction, I mean, I think if you look in trials of different techniques, it may feel that it's relatively modest, but then the benefits of medicines, if you actually look at them, are often relatively modest. And so I think it's still really, really important to be referring and taking advantage. And not everyone will follow it through, but some people do. So I think it's still worth us doing that. Quickly then, are we intent on keeping everyone alive? I really don't think we are. We do recognise, and all this, the type of thing that we're talking about, putting the patient first, or the person first, and what matters to them. People often do get to a point later in their life, particularly when they're more frail, where actually how long they live is not the most important thing. It's actually about their quality of life. And I'm worried that, John, you're not going to get anyone answering your question. I feel there's a zeitgeist around the types of things we're talking about today. And so my personal view is that while we're really struggling in terms of general practice, in terms of the types of things we're talking about today, in terms of social prescribing, alternatives to medicine, that I think whichever political party comes in, I think there's going to still be that groundswell in terms of pushing for this.
Thanks, James.
Sure, thank you. I mean, I suppose two things that come, I haven't been asked directly a question, but if like where patients might be on a couple of these. I think the first perhaps is about doctors and where they come from, healthcare professionals, where they come from, and it certainly has come up as to whether recruiting people that they've got 3 A stars, 4 A stars, whatever, is getting the right people, and some way in which people who've got personal skills should be in the mix as well. So that would be a controversial, perhaps, thought that certain patients have expressed in groups that we've run. And the second thing, again, which I think comes out of patients and picks up on this point about a sick society, it struck me, listening to all of these excellent talks, that one of the things, if you like, there's a step from medicine that comes to social prescribing, other approaches, but beyond that there's another step, which is what on earth are all the things that are causing this plethora of conditions that need to be dealt with, and we could be thinking about social media, we're thinking about being cut off from nature, with, you know, those are almost the next frontier, and where the healthcare system can make a contribution to that perhaps as well.
Thank you. Gail.
In answer to your question, every member here, social prescribing influences and has an impact. So part of my world is not just information and advice, it's also accessing a lot of the sports, interaction with the sports teams, the local council. We work well with our social services team. We're helping them understand the people that are being referred, what matters to that person, we're helping them understand. So the evidence that we're also providing is having conversations with the statutory services. We're talking about sustainability. Our evidence is helping the voluntary care sector, because what we're saying is we have this number of referrals. We need these organisations and teams on the ground to be effective. You know, they don't always want to listen to the voluntary care, so we're the kind of middle ground, kind of actually going, this is the impact by numbers, but also by evidence and the quality of what's happening. So all that we do is social prescribing. We're changing, we can influence. We're able to influence decision makers. We've got council members wanting to ask us how social prescribing is going to help them. So the power of social prescribing isn't just about the yoga or the exercise, it's the information and advice. It's about helping hospital discharge teams, it's helping the secondary care teams, it's helping the voluntary care sector, it's helping the arts and creative arts. So everything about what we do is really social prescribing. It's just the terminology that probably hides and shades what we do, but social prescribing is interwoven in absolutely everything that all of us do. So I hope that answers the question.
And just to add to that, I mean, I actually think prescribing is the wrong term. It is social connection, it's social engagement, it's social development, it's social creativity, it's co-creation. So there's a whole lot of things which does, I think, go back to referring to, it's the culture that's really important behind this, and helping people think, what is my contribution, what can I offer, what do I bring to the party, because they're the good places to go and stuff at the moment. And that bit is absolutely crucial. And I will say that I'm working with some. I work with some year two students at RD&E in Exeter at the moment, and sad to say, 3 of them have now got jobs in Australia that start in the end of this year, because they're on their way out. And I think all of them are very skilled. They're also all very personable. They're people I would want to be treated. They're fun, they're engaging, they've got the things that I think we're talking about. But I think the system it's got to be political. The system is a struggle for people, and there's got to be something that supports that. And we've also got 3 GPs in our area that want to leave now and want to move on. So it's such a shame, because there are such quality people, and I don't know what the answer to it is, but it is partly political, it's partly cultural.
Brilliant, thanks so much. Thank you again very much to all our speakers, Sarah, Jatinder, and was there anyone else?
Sponsors.
The sponsors, yes. I said thank you to them.